Good afternoon, everyone. Thank you so much for joining us for our National Patient and Family Engagement Learning and Action Network Care Partner Peer Connection call. Today is Thursday, August 22nd, 2024. We appreciate you joining us for this special call that we host twice a year. That's really meant to highlight and celebrate our amazing care partners in the ESRD community, with the hope of providing some insight, inspiration that they can take back and apply to their own situation. So very excited to have you all join us today. Before we get started, a few things to remember. We do ask that you please keep your lines muted if you are not speaking or presenting. It really just helps reduce any of that background noise. Please feel free to utilize that chat box. We will be monitoring that regularly. For those of you that are using a computer, you'll see a little chat bubble in the bottom right-hand corner, and those of you that are on the phone, it's typically in the upper right-hand corner. So please feel free to utilize that. As always, this call is being recorded and will be made public. We will post it on our website and make it available for folks to refer back to. We do ask that you do not disclose any personally identifiable information. We want this to be a safe place. So we just ask that you use general information. Along those same lines, please don't ask for medical advice or provide medical advice. We all are here to hear about experiences, but everyone's situation is different. So we just please ask that you keep that medical advice yourself and take any questions you do have back to your care team. Because again, as I said, each person's situation is very unique, and we just want to make sure everyone is following their care plan. And again, before making any changes, please speak with your healthcare team. And then a quick disclaimer, because this call is a little bit different than our typical affinity group meetings for many of you, we want to just make sure that everyone is aware that the views and opinions expressed during this call, especially by our panelists, are those of the panelists and do not necessarily reflect the official policy or position of the End-Stage Renal Disease National Coordinating Center or the Centers for Medicare and Medicaid Services, CMS. Any content that's provided by the panelists is of their opinions, and it's not intended to substitute for professional medical advice, diagnoses, or treatment. Please always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, especially before you make any changes. And welcome to everyone who is joining us. Thank you so much. So your moderators today, I am Emma from the ESRD NCC. I'm also here joined with Stephanie Hull. We are here to just help you move through this call, answer any questions, but really just looking forward to highlighting some of our amazing presenters and panelists today. So without further ado, I am very excited to present our speaker for today, Jeff Nelson. Jeff, thank you so much. Jeff is an ESRD patient with polycystic kidney disease, and his journey with ESRD began in 2000. By 2013, Jeff was starting in clinic hemodialysis in Milwaukee, and Jeff's first kidney transplant was a living donation in 2014. Unfortunately, that kidney failed, and he was back on dialysis until 2017 when a deceased donor transplant saved his life. Jeff currently serves as the chair of the Network 11 Consumer Committee, also known as the PAC, and is a member of their board of directors. He lives in La Crosse, Wisconsin with his wife of 40 years, where he works as a technical project manager for a very large convenience store company. Jeff is also an avid reader, enjoys time with friends and family, and provides support for kidney patients and advocacy for state and federal legislation. Jeff, thank you so much for joining us, and the floor is all yours.
Well, thank you, Emma. And thank you, everybody, for giving me a chance to share about this really exciting, I think, quite wonderful deliverable project that my team with the Midwest Kidney Network 11 in Minneapolis. Maybe just a little bit about that Midwest Kidney Network 11. I think, as many of you are aware, CMS has multiple regions throughout the country. Offhand, I don't remember exactly how many regions there are. I think maybe 16 or 18 regions, but I'm in Network 11, and Network 11 covers the upper Midwest states. And so our network covers North and South Dakota, Minnesota, Wisconsin, and Michigan. And so those states comprise Midwest Community Network 11. And as Emma said, I'm a member of that consumer committee. And we meet monthly and have discussions, and we're also challenged to come up with a project on an annual basis. And I'd like to present to you today a project that we did last year in 2023 on care partners and how to kind of recognize and help caregivers and care partners. So Emma, could you go to the next slide, please? So, so, one of the things about these kidney networks is that they are sponsored by CMS, and they have a contract, and the contract spells out certain things that the networks have to monitor. So they're monitoring all sorts of different metrics from different dialysis clinics and patients and things like that. So and so we kind of look at those as business goals that our network is working on. So CMS is asking those NCH Renal networks to work on projects that help support those key goals, because the thing is that we're looking to try to improve those metrics. Get more people on transplant lists, support the people on home dialysis, or help them move from clinical to home dialysis, depression screening, things like that. So that was that's the genesis, and that was the ask of the consumer committee. Next slide, please. So what we did is we met earlier that year, and we started kind of banding about a couple of different ideas about what we could come up with. Our consumer committee in the past has come up with a number of really exciting projects. Many of them are on our website, the Midwest Kidney Network 11 website, which you can Google and go out and find. So you can see some of the other deliverables that we've had, like we've had some YouTube videos, we've had some toolkits and stuff like that. We thought about maybe having like an outdoor billboard or like an indoor poster, like the Fistula First poster that you may have seen in some offices. Talk about transplant kidney care, possibly, high blood pressure, depression, toolkit, stuff like that. And next slide, please. What we did is we met with the whole group, the whole panel that we have in our consumer committee, and then we got some volunteers together to work kind of as a subcommittee, and we took those ideas that the broader committee was coming up with, and what we started to kind of distill what we're going to have this project look like. And one of the committee members thought about a possible Facebook Live presentation, which one of our members did very successfully out of Michigan. Possibly something that would be focusing on home dialysis patients. And what we decided to do is to put together an informational trifold brochure on care partners that we could share with dialysis clinics, with social workers, and also publish on our website. Next slide. So let's talk a little bit about the difference between caregiver versus care partner. When we started drafting our trifold, and we presented that draft to some of the folks on the leadership committee and on the board of directors for Midwest Kidney Network 11, the feeling, the sentiment was that the term caregiver, it just didn't fit as well as care partner, because when we look at how a caregiver gives care, whereas a care partner is more of a partner care. So I guess they'll parse it out, but the thing is really just changing the terms really kind of changes perspective from being a hierarchical relationship where it's like a provider and a patient to being peers, where we're both on the same level. We're working on this together, and we're trying to achieve a goal of better health and happiness and satisfaction. So we went through that trifold, changed the term from caregiver to care partner, And the way that it reads, I think it's a much better fit. Next slide, please, Emma. So let's talk about who's a care partner. It can be a lot of different people. And it could end up being your wife or your son or daughter, close family member. May end up being one of your friends. It's possible that you don't have a lot of family resources, which often happens. So you may end up having to work with, like in the state of Wisconsin, we have the Aging Disability Resource Centers in each of our counties. And so you may end up having to go work with like the ADRC, and then those folks will then put you in touch with some local resources that can help fulfill that care partner role. And sometimes too, it can actually end up being a team effort. Ideally it would be a team effort, because the problem is that too often it's going to be one single person, and that's where I think we end up with that risk of burnout. And when you go to the grocery store and you look around, it's really hard to identify a care partner from just a regular person. So they're really heroes, and in this case, not all heroes wear Superman capes. Next slide, please. So one of the biggest issues with care partners is really going to be stress and burnout. And I guess maybe laced throughout this presentation, I can speak a little bit about my own personal experience with care partner and being a caregiver. I mean, I have a developmentally disabled son that's now 30 years old, but is chronologically 30, but he's developmentally going to be 4 or 5 the rest of his life. And my wife, his mother, spent years in this care partner role. And my wife also took care of her father as he went through COPD and all the issues that came with being his care partner. So actually, if you were to ever meet my wife, who's an amazing woman, and as Emma said, we're going to be celebrating our 40th wedding anniversary this Friday, tomorrow. She would say she's a retired caregiver, care partner, and it's just because we've spent decades, caring for our son. My wife was caring for me while I was on dialysis, recovering from my transplants, stuff like that. So I've got a little bit of skin in the game, a little bit of experience with this, but really, being a partner in someone's care, it often starts out slow. I mean, somebody gets sick, somebody falls, somebody ends up in the hospital, something happens. Usually, though, those with some acute care issue like falling, that you heal over time. Initially there's a lot of need for some care partnering, but then it levels off, or gets less and less, and people recover. But people with chronic kidney disease and other chronic care issues, like my father-in-law that had that COPD, the COPD never gets better; it just gets worse and worse and worse. And so those with those chronic healthcare needs, they need help over a longer period of time, and that's what really can lead to a lot of stress and burnout. Emma, are you able to look at your WebEx console and see who that other person is that doesn't have muted, and maybe can mute them remotely?
I just muted them. Thank you.
Awesome. Thank you, Emma. Can we look at the next slide, please? So let's look at some of the key signs about looking for stress and burnout for care partners. One of them is going to be just, do you feel overburdened? You're trying to do all of this work to help your friend, your mom, your dad, your son, your daughter. You're feeling overburdened. You just don't have enough time for you, and you're trying to fit in everything else that you need to do, and then you've got this other new role, new responsibility, new job. You might find that you're making mistakes. You've done the wrong things in the wrong order. Did you going backtracking? Did I get that? You're tired, you're feeling fatigued, you're exhausted. You start getting crabby. Maybe you start snapping at each other. That's where you start to see that there's some stress, some of that burnout that takes place over that extended period of time when taking care of and doing care partnering for people that have got those chronic conditions. You might even get to the feeling where it may never end. That when is this going to end? When is When is, will he or she ever get a kidney transplant? Will this ever end? And, you may even get to the point where you just find yourself crying, and you start to see some of these conditions. You really got to stop and say, I need some help. Emma, can we go to the next slide, please? So, like many other things, some of the tools for this caregiver, you just got to admit that, you need help, and you just got to stop. You really got to take care of yourself first, reach out and ask for help. And it's probably not going to be asking the person you're doing the care partner with for help, but you've got to reach out for some other resources. Ideally looking at, working with social workers that are likely part of the bigger picture. If you're like at a dialysis clinic or if you're at home dialysis, you're going to maybe associated with, or affiliated with DaVita or Fresenius in some way. Would be some social workers you can contact. Again, in Wisconsin, we have the ADRCs. They can be some good resources. And if you can find a way to maybe make this like a team effort, where you can switch days and duties, that can provide a lot of respite and a lot of relief. And then lastly, also maybe join a care partner support group, because just kind of sharing about how things are how you do things, or sharing how you feel, and sharing that with another person can really, really be meaningful. Next slide, please. So looking more at like end-stage renal disease and focusing on that kind of like care partner, folks that have home dialysis, I know, like I just saw one of my friends, Lisa, is on the call. I know she's does home dialysis. And so I've got actually, I've had some nice long calls with Lisa, and I've got a lot of guidance and understanding from her about some of the complexities of home dialysis. One of the recommendations with home dialysis is you should have a care partner present during treatment. Some folks can go ahead and do treatment without having that care partner, but what I've heard is that it is generally recommended you have that care partner present just in case something goes wrong, you fall asleep, perhaps your blood pressure drops too much, things like that. But also the home dialysis machine is going to require cleaning and maintenance. Depending on your setup, you may need help purifying water for dialysate, and that monthly drop off of all the supplies. When a guy from UPS gets there with a big pallet of supplies from Baxter or whoever the provider is, and helping to receive and organize the supplies. And this is actually, of course, there's two different modalities of home dialysis too, right? We're talking about hemodialysis. When I think about my mom, because I've got polycystic kidney disease, it's hereditary, came from my mom. My mom did peritoneal dialysis, and this her home dialysis, again, just like about this guy from UPS would show up. All I remember is my mom had these Baxter boxes stacked to the ceiling in her bedroom, because that was that's where she did her cycling, and she did her peritoneal dialysis. And so, working with my stepdad to help sort out all the supplies and stuff like that. They quite simply, my mom and my stepdad needed help, and that was one of the things that I had to help out with. Next slide, Emma. So, and when we look at clinical dialysis, which is the modality that I chose for the almost 4 years that I was on dialysis, should someone be driving you to and from treatments? I know that after I had 4 hours of treatment, I was a little bit woozy, and a lot of times I'd leave the clinic, maybe I took off a little too much water, my head and my ears were kind of ringing. Frankly, I had to, as soon as I left that clinic, I had to jump onto a really high-speed freeway, and I just got into the right-hand lane, put both hands in the steering wheel, and drove straight ahead, and just couldn't wait till I got home. I know a lot of my other friends at the clinic, they had, their others come by and pick them up, or they even had some transportation that was arranged through another provider. So that's, can be one factor. Another thing is understanding these lab reports. Now, when again, relating to my own experience when I was with DaVita, they would provide a really high-level lab report, like how your albumin is doing, or how some of the other, nobody's looking at creatinine any longer, but your potassium, some of those other metrics, and they just have smiley faces and stuff like that. But there are more complex lab reports which can really give you a lot more insight into how you're really doing on dialysis. and kind of deciphering and understanding those lab reports, meeting with the dialysis nurse or the dialysis doctor that comes by every week, kind of parsing through his reports, and that can help your care partner better understand how they might change your diet. So, for example, if you've got too much phosphorus or too much potassium, you may have to adjust to your fruits and veggies and cheeses or whatever else is causing some of the high phosphorus and high potassium. So, understanding those lab reports and getting help from a care partner, that can really go a long way towards better health and better outcomes. Next slide, please. Certainly, as Emma has shared before, I had 2 kidney transplants. The first one was from my living kidney donor from my cousin Mary. That kidney transplant was not successful, and after a couple of weeks, I had that nephrectomy, and then I was back on dialysis, and then later on, I developed antibodies. I thought I'd never get a kidney transplant, and then a miracle occurred. I got a call from the transplant center. They said, "Stop eating, stop drinking, and get ready for the next call." And I had an offer. And before I know it, I was in the hospital with a blue cap on, and I'm getting a kidney transplant. But post-transplant care, this is where my care partner, my partner, my wife, was so helpful, because I was on pain medications. I couldn't drive. I needed her help. And there were so many post-transplant labs that I had to do and post-transplant follow-up visits. I'm so glad that I lived close by my transplant center and that I didn't end up getting my transplant at one of the other transplant centers that I had, like up in the cities and stuff like that, that I was part of the program. But that would have been logistically a lot more difficult. But what if it would come out of there? She would have been driving me back and forth, whatever needed to be done. The other thing too is that until I got one of the Apple iWatches, where I got a lot of reminders and stuff like that, my wife also needed to kind of remind me to take my meds at 7 in the morning and 7 at night, just because I wasn't kind of used into that routine. Now, taking my medications at 7 and 7, it's just part of my life. Next slide, please. So, team, those were some of my thoughts and observations about our caregiving. On the actual trifold that is on the Midwest Kidney Network website, there were some QR codes. They're kind of regional specific. So, the QR codes were about like how to get a hold of your ADRCs. In Wisconsin, we had some QR codes and links to some Veterans Administration sites. And but again, those were on the actual, on the trifold that's on the Midwest Kidney Network 11 website. So if you'd like to go to navigate your way to that website and go out and get a copy of that trifold. But I thought maybe, Emma, we could open, I'm not sure how you normally handle your Q&A, but where would you like to go from here? Oh, there we go. There's what the trifold looked like. So so here's some steps for coping with stress. A good QR code there with Wisconsin Family Care Partner Support, the VA, and then Minnesota Board on Aging was another good website. They had a lot of good information on care partner support and resources in that area, in that region of Minnesota. And Michigan as well.
Perfect. I'm going to scroll to the center here.
I was going to say, I don't see anything updated other than questions and discussion.
Are other people seeing the trifold here?
Yes.
Huh.
Sorry, Lacey. Let's see.
Oh, no worries. Jeff, if while I'm waiting, you don't mind, I would really like to thank you, and for everyone, including me. I was a hemodialysis care partner for 17 years to my husband, also his donor 14 years ago. And one thing that really stood out to me was your differentiation between care partner and caregiver. They are fundamentally different. And he was 7 years in center, 10 years at home. I've been a caregiver and a care partner. and so has my husband to me for different reasons, but they are fundamentally different, and it can be overwhelming when someone that, you know, this is my person, and the term caregiver is mentioned. It has to be a partnership, you know, when you go home. And it truly was. When I had time, I built the machine. When he had time, he built the machine, you know. And, you know, Jeff, you mentioned, like, if you forget something, like little things you don't think about, my phone, the remote, Cheetos, you know,
Right.
that kind of thing. Like, oh man, can you please, you know? So it really is a partnership. And so I appreciate, one, your story, and that differentiation. I'm a communication major, and so that means a lot to me, and it's a joy to be a part of other, like a world of other care partners, because it isn't as scary as it can seem. I I mean, we started when we were 17 and 19 years old. So to me, it was just a part of life. But it was okay. I mean, it was a second chance on life, and it still is. And so to me, that's beautiful.
Well, thank you, Lacey. Yeah, you're absolutely right. And it's and thinking again about how my wife and I took care of my son. I mean, that was us, you know, and it was us
Yep.
taking care of our boy. And to your point, I had time, she had time. We did it
Yeah.
together, you know.
Yeah.
Thank you, Lacey, for sharing that. There's a few other folks in the chat that also agreed with you about care partner versus caregiver. They really appreciate that. And then let's see, some folks agreeing about the symptoms that can occur for burnout. Self-care is necessary. Lots of people just thanking you for this information. Ramieka is one of our amazing care partners, and she transports her mother to and fro in-center dialysis. She put some information about talking to your insurance, about reimbursement. Absolutely. Does anyone else have any questions or anything they'd like to ask Jeff or comments on?
I do have one more comment
Sure.
slash question. And I have a, you know, a handful of care partner, like brothers and sisters in the fight. And you mentioned asking for help, and many of them that I speak with, like, so I know that respite care is an availability if you just need a break. But I also knew at the time, you know, he was dialyzing 5 days a week. If I were to say I need a break and he went in center for a week, I knew how bad he would feel going from 5 days a week to 3 days a week, because we did 3 days a week for 7 years. He was diligent with his health, and I'm grateful for that. But how do you tell someone when it's okay to ask for help without guilt coming in? Because I dealt with the same thing, and I've spoken with others that say, I feel safer with my person at home, you know, suck it up, buttercup, let's just do it kind of thing. You know, you have to
Right.
do it. We're in this together. So when I hear that, I almost feel like a hypocrite saying, ask for help, because I wouldn't.
Well, you bring up a really good point, Lacey. In fact, when you said the word respite, it just rang a bell with me because, you know, that, my son and his disabilities were extraordinarily challenging for our family. And so we were very fortunate to receive respite care through our county. And all care partners need respite.
I
And,
agree.
you know, where I live in La Crosse, in the western side of Wisconsin on the Mississippi River, there's a community organization that we've recently come to know some of the folks, and they've got some really strong respite programs. They've even got respite programs for the respite providers because,
Oh,
you know,
wow.
it's, yeah, I know, right? It's just that, it's because in some ways there's almost this transference
Mm-hmm.
of responsibility and stress, and so it's, but I think that's one thing that I did not include on my slide, and I'm glad you mentioned again, respite. That it's sometimes you just need a break for a week. Everyone's entitled to a vacation.
I agree.
And it was by engaging some of the respite providers in the county that my wife and I were able to cobble together a vacation over to Michigan
Oh,
from Wisconsin, just so we could have some sunsets on Lake Michigan. And then we just came home and we had such a different mindset, having some time away and some time alone. It makes a big difference.
oh, I'm sure you must have felt just peaceful and refreshed.
Absolutely, just time alone.
Yeah.
It's priceless.
Yeah,
Thank
sometimes nothing is best. It's a
Uh,
something, but nothing. You're like, I'm just enjoying nothing right now. It's also great.
right.
Michael added in the chat, Michael Mace, he lives in the Washington area, that they have a DSHS COPES caregivers, where an agency will come in and provide some respite, where care partners have primarily been family, friends, and
Ooh.
others. So different programs around different states. Please feel free to share anyone else who knows of other programs. I think that's the best way to learn about some of those programs is just word of mouth. Sometimes they're challenging to find online. Thank you, Michael.
Emma?
Yes.
Yeah, I just wanted to say that, in my situation, I'm going over a decade, and of course, most of you know that I've had two care partners, and one of them, my former husband, died, and now I have my cousin who works full time, for Nike. And what I've had to do, and of course, I've had a recent hit and run accident, and a lot of things happening. Jeff, and it was wonderful that he mentioned things happen. You have to think out of the box. Now, I'm a member of a church. I have meal runs. There's always the grocery service. Okay. You have neighbors. I have good neighbors. I'm from, I've been in Seattle, and after I retired, I went back to Oregon. It is very, very different in Oregon. Okay, it's the West. Not too many, a lot of units have even closed. So it's really important to think out of the box on your various needs. And you know what? So, yeah, you got to buck up, buttercup, when, as a patient, you got to do the medical supplies. You got to do things. Now I got a kind of a sprained wing here. We're on the mend, and, we're right on track. But you've got to really think out of the box, and you have to look at your care partner. In my case, my cousin, who's my third cousin through adoption, he stepped up the plate. I was going to end up in the center, and he was gracious enough to do that. And he had, medic experience from the Army in the 20s. So that was a fluke. And I have a pet, Max, which of course pictures are coming with his new beachwear before summer is out. And so really when you extrapolate and you think out of the box, because I'm adopted, I have just my cousin. I have nobody else. And I'm a church member. And these people love me. They want me back. They want me back singing. I'm a scripture reader. And when you get a pool of people, and based on the situation, for example, I have to be in a stationary position. I normally have a neck brace, and I'm lying down. Okay. What do? Well, guess what? There's a neighbor. I got myself up. I opened the window and I cried out for help. That was 4 days ago. The neighbors are coming. Neighbors are coming. I have a loud voice, as you all know. So it was help. It was help to feed me and my dog. And because my care partner, he's at the max. He's getting ready to go to work right now. He's gone till 1 a.m. I'm by myself. We put easy things, cook in the morning, cook for a couple of days, pre-make stuff, have it in the fridge, have things ready. Think beyond. If you got to think beyond today, tonight. You got to think about the week, and you got to think about, in my case, we've got someone here that needs to make a paycheck. Okay.
Sure.
That's why I work part-time, as hard and difficult as it is. And I've had to put things off for a while, and that's not typical of me because I've always been with the network and very, very active. So and give yourself grace. Give
Definitely.
yourself grace. If you can't do it, don't do it. Okay? Don't do it. My
Thank
God.
you.
And that's really it. And give him grace and talk about it. But your care partner has to have a life. You have to shove them out the door. You have to tell them, go have dinner, whatever, go be with your friends. And you have to be alone, and you have to be comfortable with that. Have your things together. Pray. I'm a praying woman, and I'm praying. And believe it or not, with like you people, the people in the network, KPAC, I'm on KPAC. I call various people when we're near the end, and I need prayer, I need advice. And I think it's all of our ideas. And thank you so much, Jeff. You did a wonderful presentation. You've opened the dialogue. People are talking, and
Thanks,
that's what's
Lisa.
important.
Thank you.
And I have
Absolutely.
to get off the machine,
Thank,
so I got to tune out. So thank you so much,
Lisa.
Irma.
Thank you. And
Thanks, Lisa.
we actually have some panelists with us too, so I want to give them some opportunity to share their story as well.
Great.
Before I do that, Jeff, thank you so much. Lisa just said it. Thank you just for, bringing this topic forward time and time again. I think it's just so important in allowing this conversation to happen. So we'll keep watching the chat for any questions. I know you're a busy man, so if you have to hop off, that's completely fine. We'll share them with you, but if you'd like to stay, we'd love to have you stay on for other questions. But thank you so much for that amazing information. So next up, we have some of our own care partners who are part of the National Patient Family Engagement with us today. Here are two of our lovely couples. We have Michael and Christina Gilchrist. They unfortunately were unable to join us today. However, we are very, very lucky to have Ramieka and Keith with us. Are you all able to?
Can I say one thing? Shout out to Michael and Christina. If you don't know them, they are ridiculously cute. And one thing I love is that my husband, Sam, who was the dialysis patient, was called to present in Utah, and Christina heard him speak about HHD, and that's how they started. And they have carried the torch for home dialysis, and I love them. I'm so sorry they couldn't be here today. They're hilarious and adorable. I just had to give them some props.
I appreciate that. Thank you. We look forward to having them another time because I agree, they are wonderful. So today, though, gratefully we have Ramieka and Keith McDonald, equally amazing. Thank you all both so much. I'm going to tell you a little bit about their story, but they are going to fill in the holes for you. So back in 2006, Ramieka was diagnosed with chronic kidney disease while she was 6 weeks pregnant with their first child. She successfully carried her child and had a second before needing to start dialysis in 2015. Her first year on dialysis was in center until she learned about home hemodialysis and how it would benefit their family. And meanwhile, Keith, her husband, was not only her care partner, but he was also a CNA at a local nursing home. And during this time, because he was so amazing, he received the American Kidney Fund Caregiver of the Year award. At that point, I think after some encouragement, Keith decided to become a hemodialysis technician. which he continues to do today. And now Ramieka remains on home hemodialysis and homeschools her 2 children. So Ramieka and Keith, welcome. Thank you so much for being here.
Thank you for having us.
Absolutely. We are so grateful to have you both join us. I know I just shared a little bit about your story. Is there anything else you'd like to start us off with this and tell us about your journey of being a care partner, Keith, or having a care partner, Ramieka?
Oh, no, you said everything. We can go now.
I can't seem to turn on my camera. Sorry, I'm having some technical difficulties here.
No problem. We will put Keith's face right in the center here for everyone to see. Well, again, thank you all so much. We just want to hear just kind of more about your story. So Keith, I'm gonna turn to you, and you know, you seem to have been a care partner by trade. You were a CNA, you know, now you work as a tech, but I wonder if you would be willing to share a little bit about your experience of becoming a care partner to Ramieka.
Sure. Hi, everybody. When Ramieka was diagnosed with ESRD, we had we had to make some adjustments. When she actually had started going in for training for home hemo, she went in for about a week before I started coming there, just get used to it. And the first day that I showed up, the nurse said, "Okay, go ahead and cannulate her." I'm like, "What? You don't want me to practice on an arm or something?" No, go ahead. Just go ahead and put the needle in. No problem. Okay, I'm sleeping on the couch tonight, I guess. Um, but yeah, I according to the nurses, I picked it up pretty quickly, and they pretty much threatened and blackmailed me into signing up and going in for formal training as a dialysis technician. So, and that's
Nurses are good at that.
yeah, she found a way to apply that pressure. Yeah. And it's funny because we had there was another nurse, I think she was actually in charge of the home program. She had talked to me while Ramieka was on in center, and said something along the lines of, "Yeah, we'll get you in the company, no problem." I'm like, "What are you talking about?" And then, of course, as I become a technician, and then I see her later on, she's like, "See, I told you we were going to get you." Oh, um, so I've been a technician since 2015.
Thank you.
Yeah, it's yeah, when you say I've become a care partner by trade, it's kind of just more like a lifestyle now. So I work at the dialysis clinic, come home, and then on my off days, that's when we do Ramieka's treatments and appointments and such. So yeah, it's pretty much dialysis 24/7 around here.
It's a calling.
Yeah, we're about that life.
Ramieka, I wonder if you'd be willing to share what the experience for you was like having Keith become your care partner once you returned to home dialysis.
What's it been like? I have to say that it's a good feeling because I feel like you know, I have my own dialysis technicians, you know. Like, you know, some patients have told me that. They're like, "Oh, you have your own personal, you know, a dialysis technician, you know." But I have to, you know, remind him also that, you know, you're not just my care partner, you're my husband. And, you know, I always encourage him to, you know, stick to his hobbies and you know, keep drawing because he's an artist and he's actually a published illustrator. He did his first children's book. So proud of him. So, I always encourage him to take time and stick to, his talents, his hobbies, things like that, because, like someone mentioned earlier, it's important for care partners to live their life. And, I try to encourage him to do that, but it's been so great. He takes such good care of me. I cannot ask for a better husband, a better care partner. These 19 years we've been together. This journey started a year after we were married.
Hmm.
So, he's been by my side every step of the way. I mean, and he's never complained. He's never complained of being burnt out or anything. I have to tell him, listen, just chill, take some time for yourself, go out, do stuff for yourself, because if I don't remind him, he won't do it. That's the kind of person he is. He's so dedicated and he's so devoted. That's why I totally, he had no idea, but I contacted the American Kidney Fund and I told them my story, and immediately they nominated him. They chose him, and he won the award in 2014.
It's amazing. I love that.
I have to add,
Um,
my husband is technically the patient. I prefer a person on dialysis when he was, but he was the one, like, no one knew he was on dialysis unless he told them. He played soccer, finished his degree, we got married. I mean, I still can't keep up with him. And he's going on a transplant like for 14 years now. It's like, boo, oh my gosh, how do you just pop out of bed so happy at 7 o'clock in the morning every day? And we met in high school, and he's been that way the whole time, on and off of dialysis, transplant, everything. Yeah, he's my inspiration. I mean, I didn't mind being a care partner, but he's resilient, to say the least. So good on you
thank,
and both of you for taking care of each other.
Keith, thank you, Lacey. Ramika talks, and like Lacey's saying, that she kind of has to encourage you to do the things that bring you joy. And I'm sure being a care partner brings you joy, but what are the things that you turn to when you are feeling stressed out or burnt out? How do you manage that?
Um, I internalize everything really. But when I'm actually thinking about it and doing what I should be doing, um, I try to find creative outlets. I picked up 3D printing as a hobby, which I didn't realize requires an engineering degree on top of it. Um, and then biochem also. Drawing, like she had mentioned, just working on things like that. Just finding some kind of outlet. I don't have I admittedly don't have a whole lot of energy left at the end of the day. So, going out for a run or something is not really within the realm of possibility right now. But yeah, just finding creative outlets, story writing, drawing, model building, things like that, playing video games with my kids. Um, just finding other things that, as much as sometimes you might, I mean, for myself, I might find it to seem harsh, but I try to find things as far away from dialysis as possible without forgetting about the dialysis. You know what I mean? Like, yes, it's there. I have to, we're dealing with that. We take care of that every day. But as far, I'm not out here writing, putting together kidney models. I'll find a spaceship or a dinosaur to put together or something like that, something as far removed from that as possible. And Ramika is really great about not only just allowing me that space, but actually, being being the boot in my backside to get me to do those things.
Mm-hmm.
You know,
Absolutely.
because she and I have had discussions about as a care partner, as her being the one on dialysis, she also doesn't want her dialysis or her kidney disease to be I don't like using the word burden, but she doesn't want that to be the wet blanket on our relationship. You know, she wants that's just something we have to deal with, that's something we have to do. Don't let that be the be all and end all of what guides what we do outside of the dialysis. So yeah, we're not going out partying and drinking all night. You know, we wouldn't have been doing that anyway, but you know, we find, try to find things, other outlets to go to do. And also I encourage her to find other outlets, also creatively, with her writing and just poetry writing or story writing or things like that, trying to find ways to, find good creative ways of escapism,
Right.
so that it's not constantly in the back of your head, oh, I have to do dialysis, so I have to set the machine up and I have fluid restrictions, so I can't do that. It's just, today we're not worrying about that. Today we're gonna play Dungeons and Dragons, or something like that, So that's pretty much it's a lot of, and I will say I am very proud of her because I am very hard headed when it comes to that. When I say she has to she has to be the boot in my behind about it, she really does have to be the boot in my behind about it. She's, sometimes I get locked into work mode and she's like, you do know you have to sleep sometime, right? You have to you have to take some time away from dialysis, whether it be at work or at home. Just go do something. I'm tired of looking at you. Go do something else.
It sounds like she also plays a care partner role for you as well, reminding you to, take care of yourself.
Absolutely.
One of the questions that always comes up when we talk about care partners, especially when your care partner is your spouse, is how do you all communicate so well? Your spouses, your parents, and then you also, she's dialyzing, you guys have work. What are your best communication tips for folks who are in a similar situation? And Ramieka, feel free to hop in as well.
I would say honestly.
Go ahead, Ramieka.
I'm sorry?
Oh, go ahead.
I interrupted, sorry.
No, it's okay. Emma, I'm so sorry. Can you repeat that again?
Oh, yeah, we're just asking what your favorite communication tips are, or how you all just manage all the different facets in your life and be able to communicate with each other smoothly.
Well, I always let him know what's going on. Like anything that's had to do with our children, we always let each other know what's going on. It's all about communication, always talking. We talk a lot about our feelings, about, what we want to do with the kids, our plans, things like that. I guess that's how come, I guess that's why we've had a good marriage these 19 years. Because we do talk a lot, and I'm all about, expressing how I feel all the time. Maybe a little more than my husband, but I don't know. You got something to add, hon?
Well,
I do. Oh, sorry, go ahead.
I would say our communication style is very deliberate.
Mm-hmm.
If we try to leave as little, we try to avoid any gray areas. So this way we know exactly what needs to be said, what needs to be done, because as spouses, we do that, we should look to do that normally, but also as care partners, we need to have very clear and concise communication about everything, just like in a regular clinical setting. So basically, our communication as far as Rameka's treatments are concerned is pretty much like getting report from one nurse to another, or a doctor or nurse to a doctor. We try to maintain as much of a clinical setting with that as possible, so that we don't get any kind of ambiguity with how we might be feeling with each other that day as spouses. You know, maybe I snored too much the day before, you know, so and then she's not feeling me that night, but she's got to let me know, hey, I was cramping a little bit, or my arm's feeling this way, or, you know, have a little trouble, you know, shortness of breath or whatever. Let's make an adjustment here or there, or we need to get different medication. But we try to maintain a very deliberate communication style, so that we don't have any question. Yeah, we have, I obviously have questions, but there's no ambiguity in what we're talking about. Especially some patients experience brain fog, so she might not remember that we've discussed something. So we have to be very deliberate, very patient with each other. And then everyday fatigue, you know, as far as my part, you know, I might have forgot. Oh, yeah, I forgot we talked about that. But just being very deliberate with everything. That's one of the major keys to maintaining that communication, you know, as a care partner.
I love that. Thank you so much for, explaining how those types of communications are different when you're doing dialysis versus when you all are parenting or, being partners. It's very different.
Can I interject one thing? I promise I'll be fast. I know we're almost out of time. Something, Sam and I have been together 30 plus years, and we discovered a long time ago, the word you can be detrimental in a disagreement. You did this, you said this, so it's accusatory, and we try to reverse it. When this happened, I felt like, and so it helped us not like become defensive. And so if you can just modify the words, going back to care partner versus caregiver, instead of saying you,
Sure.
I felt like, so just one little tidbit.
I think that's great. Yeah. And Ken added in the chat using those I statements. Gosh, this hour just flew by, and I think we'll have to plan a part 2 here and invite Keith and Ramieka back. But because we are at the top of the hour, I just want to thank everyone so much for being here, but especially Keith and Ramieka and Jeff. This information is so valuable to this community, and I think more conversations need to happen around care partners, how to support, what resources are out there. So we appreciate you all sharing your stories. I'm going to unpin you, Keith, but you're still there. Don't worry. And just to wrap up today, please remember we do have care partner resources on our website, our ESRD NCC, and we're also always looking for more resources to create. So part of our NPFE-LAN is looking at what is missing and developing those resources. So keep an eye out for some new resources towards the end of this year. But to wrap things up, thank you all so much for joining us today. Please send any questions you have in. We can filter them out to any of our speakers or panelists today. And we appreciate everyone participating in the conversation. We will be having another one of these calls in the next couple months, so keep an eye out for those. If you are interested in joining us, please let us know. But again, thank you all so much for a little bit of your time. Keith and Jeff and Ramieka, appreciate you as always. I hope everyone has a great rest of their week and have a great weekend. Thank you all so much. Take care.
Thanks, everyone.
Thank you. Bye-bye, everyone.